Yeah, and I think it's not easy to change language, like invent new words, but at some point in history, all the words have been invented, and
Yes.
in a way, I feel that English language is a little bit lacking its physical activity, exercise, and sport. And like you said, people don't really relate to physical activity. Exercise is kind of really intentional thing that you do sometimes and you don't enjoy for most people. And sport is kind of more about games, more about this kind of
Mm, mm.
playing. So I think there's even missing a word for kind of daily activity. I,
Yes,
I think
yes.
English language is missing words. In Finnish language, we actually have word which is derived from movement. It's a little bit different than movement, but people know it, and it kind of means all of those. It
Yeah.
doesn't define one of them, and I think it works really well for the physical activity promotion.
Yeah, and and Finland have got a great tradition of for a much longer time consisting that sort of fit for life campaign, bringing and interesting. See what you make think of this. But one of my theories about physical activity campaigns is they should never be run by a government.
Hmm.
And what I liked about the Finnish model, it was run by the charity sector, the sort of Heart Foundation.
Hmm.
So if you're going to ask people to think about something, if the government asks you to think about doing your taxes, you probably get a bit
Yeah.
anxious and react to that. If a charity asks you to think about something, then you have a different affective response, and
Hmm.
perhaps that's why the Finnish work has been fantastic, because it's always been outwit the government. It's had the government helping and supporting, but they're
Hmm.
not the public face.
Yeah.
Um, so, and perhaps coronavirus has taught us that actually, government directives and edicts provoke responses in people who generally wouldn't respond in that way if it was a different voice telling them.
Hmm. Yeah.
But that's
Yeah.
another podcast.
Yeah, and I think the words are really really important. Like in Nordic countries, you have free heads live it a little bit different ways, but it means kind of all activities you do outside. It's kind of camping also, and this kind of
Yeah,
things. In
yeah,
Finnish, we have ulkoilu, which means like just moving outside. It doesn't make difference what you do outside. And I think
that
those are
sounds
also easy
perfect.
to communicate, that get out of the house. It's also for
Yeah,
psychological benefits. So I think English language, we should be brave enough and actually invent words. Probably they don't start working quickly, but hopefully at some point in the future. Well, what do you think?
yes, I completely agree with you. And in fact, in the recent COVID lockdown in the UK, the language used in the first lockdown was you're allowed out of the house to do your daily exercise for
Hmm.
30 minutes.
Yeah.
So, in a way, we almost went back 15 years instantly. And actually, what it did provoke us as a body of folk working on communicating physical activity and led by Professor Net Mutri, wrote to the chief medical officers with ways of rephrasing that particular edict in a way that would be more positive.
Hmm.
Spending time in yourself, going outside just to refresh, change of scene, those sorts of things. So
Hmm.
I think it's much more about the process rather than the outcome
Hmm.
that we need to sort of focus on. But yes,
Yeah.
so we need to be more Scandinavian. Clearly, we need to be more
in
like Finland.
in some sort of some things maybe. Yeah, and actually the language, it's interesting. We are working with our company Fibion. We are doing like a concept for the kids, and I was writing a script. We do a cartoon animation, that the
Yeah.
feedback from the measurements is a cartoon animation, and I was writing the script now, that how do I talk
Lovely.
about MVPA. And I've been consulting one professional who's working with the 4-year old, and they had, for example, a test that put the hand on your throat, and do you feel the happy jumping heart? And so I tried to relate that to this, kind of tell the story of happy jumping heart,
That's
that people
great.
would think,
That's really good.
yeah, not my idea, but I think it was something. And then really struggling that how do you communicate, like when do kids know that it's certain intensity?
Oh,
How could we
yeah.
talk about vigorous intensity activity? And Yeah, I'm really thinking like, how do you talk 4-year-old
Okay.
language as an
So
academic
I
background?
don't know. I don't know if it was help, Ollie, but you sparked me. So Professor Ross Jago had a really brilliant PhD student, and I apologise, her name slipped from my head. But she looked exactly at that for parents of toddlers, and the words that they came up with in English were huff and puff.
Yeah, that's.
Do things that make you huff and puff.
Mm,
I just thought it was brilliant because it kind of encapsulated to me what you want. So
yeah,
there you go. See what you make of it. It may work, it may not, but I'm sure there's an equivalent of that.
yeah,
So
yeah.
good words.
Yeah. Do you have any other recommendation for kind of children? We thought that we follow the World Health Organization kind of sitting less and doing MVPA and then doing something like very intensive. I don't know how do we frame it, but it's kind of important for the motor development, bones, and so on.
Yeah, yeah,
But
yeah.
what would be your takes? How would you communicate to children
Put me on the spot.
themselves, not only the parents or adults?
Gosh, it's nearly 50 years since I've been that age. It's I don't know. I don't think there's an easy answer because I think we'd all be saying it. But if we want to communicate to children, we have to use the words that they use. And I remember we were talking with some children as part of a research study talking about play, and I kept talking about play, and they were looking very blankly at me because they thought it meant a theatre with a stage, and they were in a no. And I went, right. No, you know, playing, and they went, oh, you mean playing out? So playing out was going outside of the house with their friends and just playing, you know, playing a game in the street, kicking a ball, playing on bikes, chasing each other, that sort of thing. So you're really precise about what that is and means. And perhaps, you know, you take the domains of physical activity and you rephrase them into children's language and ask them to perhaps to choose things where they get a bit like your Finnish pie, a bit there, a bit there, and a bit there across the day. Make an activity meal out of these. That's just an idea. I don't know. But
yeah. No, that's important. I think we will just first make a version and then show it to kids and look for the responses. That do they actually understand? How do they think about them? But yeah, that's.
I love your cartoon feedback. I think that's really interesting. That'll be really fascinating.
Yeah, and it's a little bit difficult. I'm excited doing it because we have tested it with some kids, like the first versions, and they are engaged. They really look at them, but then at the same time, we don't want kids to get the idea of kind of medicalized physical activity. So you want to tell about benefits, because I think it's really shame if somebody gets overweight and had bad fitness. It's not nice, but you really don't want to medicalize it in their minds. So how do you tell about the advantages but not give a wrong impression?
So we had exactly the same experience working clinically, and you know, people would say, well, you know, is that enough? Is that good? Am I bad? You know, and they'd almost self-label, and what I would try and do is present that kind of threshold, the information in a neutral way. Say, actually, some people find it's really helpful to be told exactly how much to do. Other people kind of are just comfortable working out for themselves. You know, would you like to hear what, you know, the recommendation for how active adults need to be at the moment? And they go, really, okay, or no, and you share it, and you say, so what do you think? How does it sound? And then you sit back and let their reaction dictate what you do next. And that kind of client-centered approach that you can use clinically is very helpful, but it's quite difficult to do it in a kind of in a different context when you're kind of transferring information from one point to another. So that kind of rhetorical question, you might need that at the end of your cartoon.
Yeah. And actually last week I was having a podcast recording with Professor Amanda Daly from Loughborough.
Oh, yes. Yeah.
And she's doing this physical activity caloric equivalent labeling thing with the food, and we discussed that that's also really, really difficult. It's important that people understand how much you need to move actually to burn a cupcake or something, but it kind of brings the idea of food into wrong direction. But I cannot make up my mind. Does it have more benefits or yeah?
Yeah, that's an interesting study. And of course, whatever you choose the comparator to be, it has an inherent value. And it may not be the value that you've put on it. So you might say, well, it's 3 apples rather than 1 chocolate bar. And whichever way you go, people will react differently to the comparator. So that's an interesting challenge. And I know those sorts of approaches have been tried before, and it's a challenging area to kind of communicate it in a way that doesn't have a value attached to the outcome.
And if we go to the physical activity guidelines in national guidelines compared to the global ones and World Health Organization, what is the status at now?
Well, at the moment, so 10 years ago we had convergence. We had similar physical activity guidelines, particularly for the aerobic components, almost unanimously across high-income countries. I'm sorry, I'm speaking about US, Canada, New Zealand, Australia, UK, Europe. And, there was convergence definitely around the moderate message. And I think in the last 10 years, we've drifted apart again a little bit. And the WHO guidelines are a very good opportunity perhaps to kind of reconverge around things. But, our guidelines are different to the WHO ones. Our age groups are different. Even the way we've cut the life course up is different. Because that's the way that our services are organised. Literally, for young people, they go up to 25. Well, the guidelines go up to 18, but in some parts of the UK, services are 25 or so. Just that sort of simple area. I think the WHO guidelines have been fabulous. I think my only gentle criticism might be that they're quite complex. They've actually made more things in them than less, but that's okay. The challenge will be about how we communicate those to policymakers so they can adopt them and then reflecting onto their public and populations and health systems or wherever they need to be disseminated. And that's really where we find ourselves. We've had guidelines for 10, 15 years, and we're suddenly sitting back and going, well, what do we do with them? Over here, here's our physical activity guidelines on my desk. How do we make these come alive? We've got the infographics in here. That's great. But, we have a committee, and in fact, we have a Scotland pilot now, which is fabulous, on how we band together the communication of physical activity guidelines across all the stakeholders in a system that talk about movement, from transport to sport to education. So, that's really, really interesting. Just even organising the communication of their own materials, but making sure that there's still a spine of the correct information that's positively gain-framed, etc. That's would be a brilliant first step. So, the physical activity guidelines internationally, I think, are fairly similar, but I think we have to allow for local nuance. And I'm working with a country in the Far East, in Singapore, and we're trying to make sure we can add a Singapore spin to the physical activity guidelines, because every policymaker wants to be unique and different and world first. And so we have to kind of, make sure that's appropriate for them. And they're doing a fantastic job. Real insight into the next stage, which is making the guidelines come alive for their population. And I'm really excited about that work. So it'll be good to see where that goes.
And this might be a silly question, but national guidelines, who are they for? Like, you have the document. Who is it for? This document, this kind of form of text.
Hang on, I'll check. I think they are for, and certainly they're for a scientific and certainly a medical community. It was commissioned within a healthcare system by our chief medical officers. So they see that that's the first natural community for which they are, for the health professionals who do clinical management for conditions related to physical inactivity or activity. So, we have all those folk in the system, but they are kind of standalone. There's almost like when you get your four suits of cards in a card game. I think you want to have the four suits. You want to have all the different cards: hearts, clubs, spades, and diamonds. We've got alcohol, smoking, physical activity, and probably screen time might be in there, or some other health behaviour as well. And I think public health agencies recognise they have to work across these different areas. Sexual health, for example, is another one. So having a suite of kind of population recommendations kind of feels like you're a maturing public health agency and body. That's interesting. That's an interesting place to be.
Yeah, but basically, when we talked about the language, these guidelines are for professionals. So they can be a little bit more complicated language, but we need to remember that when we start to communicate it to pregnant women, children, adults, youth, we probably need to modify it quite a bit. And I think quite often we use the same language, right? And
yeah, absolutely, Ollie. You nailed it. That is a beautiful summary of the challenge we face.
Yeah. So where do we go next with the guidelines?
Oh, good question. Okay, so look, if I look forward in the future, I think things might become a bit more complicated. I'm hoping on one front we just get better engaging with the public and learning their language and learning their views, reflecting that in the way we communicate with them. That has to happen. But the next sort of challenge will be when you'll love this is device-derived indices of movement and activity. Because I think they will change some of the assumptive relationships we have between physical activity as measured in different ways through questionnaires and relations with health outcomes. And I'll give you an example. There's a nice paper published out of the Cambridge MRC group looking at device-derived indices from accelerometry across a whole different numbers of predicted mortality, morbidity. And that dose-response curve that we love, that beautiful ski slope, that it wasn't there. It was some things it was going in other directions from the derived, and I think that's going to challenge us because we have to take the device-derived indices and turn them some way, if possible, back into behaviour that people will understand. Because I can't see a physical activity recommendation being 7,000 millijoules of movement, millihertz of movement. We're going to have to somehow back translate that to something that well, certainly someone like I can understand, and also then the public can understand as well. So we'll look forward to seeing what the dark arts of the device-derived indices will come up with. And I know there are many arguments within that community about just how do you deal with that kind of data. So, but it will change the way perhaps some of our relationships we see between movement as derived and measured by those mechanisms and our health outcomes.
Yeah, that's a good point. I think the current recommendations are for the questionnaires of how people think and remember activity. And we have noticed also that when you have, for example, Taiwan device, you usually get the MVPA because it's measuring everything, like just one fast step here and there, and it accumulates during the day. It's probably those people are not active enough, even though it seems that they get it. So I think it's difficult to communicate for people to think and remember, and then some of them have the devices on their wrist or elsewhere. So how do you see, how can we manage this in the recommendations or in the future?
Well, I think as scientists we have to acknowledge that there are issues that are sticky between constructing metrics of activity and status from these devices. So cut points are contentious, for example, as a way of doing it. If you apply bout length, well, we don't need to do that in behavioural recommendations, but if you don't apply bout length, cut points and that kind of data, that's also interesting. You might throw a whole bunch away. So, but then we have to work what that as an exposure measure actually means in terms of health outcomes. And then if it's meaningful, we have to retranslate the exposure measure into something people can understand. I don't know how to do that yet, and I think that's the real challenge. But I'm hoping people will be able to help us with that, which is why, of course, the kind of commercial devices, your phone that tells you how many steps you've had, your watch that says how many activity points you generated today are actually useful because they're going through that whole cycle immediately for you. And you get the behavioral reinforcement. But making that as a metric for a public health level population physical activity recommendations is a new challenge. So we'll probably still see the same things for the next 10 years, but I think I predict they will change because these short, light bouts of activity, light intensity bouts of activity may actually be really, really important, particularly for older adults who move less.
But, so some challenges for the future.
Always.
It's been really, really interesting discussions. Do you have something you would like to add here?
No. Well, first of all, thank you for letting me ramble on about guidelines. They've been a massive privilege to help construct. I've worked with some fantastic academics, both in the UK and also internationally, and it's odd, but for many academics, it's not their day job creating guidelines, but they get called in to do them. And for me, it was my day job to do them. And I just think what we have to do is bring forward a new generation of all scientists who recognise their work can contribute to this. It's not just the epidemiologists who do this or the behaviourists, but actually everybody who is involved in physical activity promotion has a stake in making sure that what we are asking people to do or encouraging them to do is based in evidence, scientifically sound, and is safe. That's what I want.
Yeah. And if you have anything to advertise here, PhD position, researcher position, or a collaboration, you're looking for something, you feel free.
No, thank you. Well, we're definitely looking for a collaboration around e-bikes. We're arranging Institute for Global Researchers who are doing work around e-bikes and their application. We have 2 trials on cancer prevention and post-cancer treatment that we're underway, and we're looking for others around the world to connect around e-bike related work. So that's a definite. We're always looking for brilliant PhD students, particularly keen to hear from people who are interested in these particular areas, that kind of applied side of things. And of course, we run a fabulous master's program at the University of Bristol. And I would strongly encourage you, if you've just done an undergraduate degree anywhere in the world that's related to a science, we take psychology, biochemistry, etc., come and learn about physical activity, nutrition, and public health. We combine the 2 behaviours because they're linked. So come and join us in Bristol. We'd love to see you and help study and learn from you and with you.
Yeah, no, that's good. And I think the e-bike thing is very interesting. I actually noticed just yesterday in the news that BMW had a concept that it's kind of between e-bike and a motorbike. And it changes that in the city, it goes like 40 kilometers per hour, on the trails 25. And outside the city, it goes 60 kilometers per hour. So you can kind of travel with it. And I think it was clever, like out of the box thinking. And I think those e-bikes and some kind of new concepts will really change how we think about getting from place A to B. So I think it's
you're
nice
absolutely right.
Study.
We're seeing them in higher schemes across cities. And of course, we've got their kind of rival, the scooters. The e-scooters are the new rivals on the block, which probably less health promoting, I suspect, but who knows. But I'd love to hear from people. That would be fantastic. And it's been a massive pleasure chatting to you today, Ollie. Really appreciate it.
Yeah. So thank you, Charlie, for taking the time.
Okay, great. Thank you very much. And good luck, everybody.